Hello, you guys. I'm Tony, your Trauma Cash president. I'm excited to connect with you and support the incredible work you do in the personal injury space. And also, I'm very proud to share that Trauma Cash sponsors PI Today podcast, helping bring valuable insights and medical education to our community. Don't forget to like, comment, follow, subscribe, and share this episode. Enjoy the podcast and see you guys next time.
Good morning. I'm your host, Dr. Nicholas Aloy. Welcome to another episode of PI Today's podcast. Thank you for joining us. As usual, I bring you guys the latest and greatest of the wonderful doctors and physicians and providers, facilitators in our field. Today, we have the honor of having Dr. Benji Tehrani, Podiatrist here. Dr. Terani, thank you so much for being on our show.
Thank you.
Really appreciate your time. We want to continue in our segments in introducing doctors that take care of a lot of our musculoskeletal issues, and podiatry, just like orthopedics, is on top of the list. So, Doc, please introduce yourself. Where did you get trained, schooling, and how long you've been doing this? Tell us about yourself.
All right. Well, thanks for having me.
My pleasure.
Very happy to be here. I in my 10th year of practice. I did my undergrad at the University of Texas at Arlington, podiatry school at Temple University in Philly, and then I trained at a level 1 trauma center in Phoenix, Arizona for 3 years. We did a lot of limb salvage, a lot of burns. We're actually associated with Arizona Burn Center, so we saw a lot of blast injuries. And my first year I did general surgery, so I was doing things like plastics, neurosurgery, orthopedics, emergency medicine, trauma. So I was doing trauma surveys. And the reason why I bring that up is that I'm very well versed with working with other subspecialties and primary care doctors as well, and working as a team to take care of these patients.
That's great.
Yeah.
And in my past experience, ankle fractures, foot fractures, crush injuries. What are some of the cases that you treat and in personal injury?
There's a variety of different injuries. Typically, ankle sprains, ligament tears, tendonitis, everything from heel pain to metatarsal fractures, ankle fractures. Crush injuries, typically they get taken care of at the hospital because it's such a severe injury that they'll have their surgery, and I typically end up doing the aftercare. Some of these patients are smokers, have vascular disease, they're diabetics, and they don't heal. They'll have these nasty infections. They may need to go back to the operating room to have skin grafts or to debride the wound. But yeah, anything under foot and ankle, I cover and I see very commonly.
Yep, wound care is pretty big out there, right?
Huge,
Yeah.
huge. Yeah.
Especially with a population who's riddled with diabetes. How do you treat those patients when people have really bad diabetes?
Yeah, that's a great question. I actually had one 2 summers ago. It was a nice lady whose foot was run over by a limousine. She was wearing sandals, and she is a diabetic, and she ended up losing half of her foot. So, these patients, when they come in, every patient is different, right? So someone could be a chronic smoker, someone may have an open wound, someone may be a diabetic that's uncontrolled. So I rely on our internal medicine doctors, our vascular specialists, to make sure that these patients have adequate blood flow and oxygen getting to their feet. Because unfortunately, even if they have surgery, even if they have vascular surgery, there's a good chance within 1 to 2 years that those same arteries that were feeding the skin, they may deteriorate and they may need to have another procedure. So with wound care, you never know that, these patients, some of them get lost to follow-ups. Some of them don't have rides. Some of our patients are diabetic with open wounds, and you're talking lacerations and dog bite injuries, and we won't, it's hard for them to get rides sometimes to come see us in the clinic. So it's paramount that the very first time we see them, that we start screening them for underlying vascular disease, make sure they're doing ultrasounds to make sure that veins and arteries are open, and just ensuring that they come to our office every 1 to 2 weeks for debridement of the wounds.
That's great.
Yeah.
And what is the difference when somebody, let's say, gets a ankle surgery with implants? Some remove them, some stay in. Tell us a little bit more about that, about the implant removal, or maybe have such instability or healing issues that you guys leave the implants in.
That's a great question. Yeah, for ankle implants, typically after 10 years, the actual implant itself will start to disintegrate or break down, and patients will have instability. They'll start getting swelling again. They'll report like when they go hiking or if they go up and down stairs, they're starting to have pain again. And unfortunately, a lot of those times it's better to fuse the joint versus just removing the implant and putting a new implant in. It's a very technically difficult surgery. The success rate, as much as I want to say it's super high, there's a lot of complications and there's a lot of gait abnormalities that they can have after their surgeries. Patients that are obese, they're putting all that weight on their ankles. Those implants may only last 5 years. And we routinely saw it in residency where they'd have an ankle replacement, and then by the time I finished my training 2 years later, there they were again, needing to have another replacement, or what's called an ankle fusion, or what we call a pantalar fusion. But the good part is that even if that happens, if we were to do an ankle fusion, a lot of times those patients do very well afterwards. Yeah, they're not able to go bowling or salsa dance. They can't really bend at the ankle anymore. But as long as they have pain resolution and they're able to live, a comfortable life that's, able to do activities of daily living, I think that's a pretty good outcome.
Okay.
Yeah.
That's amazing. And now, what about I've seen some patients that have their amputees, and like you mentioned, one of your patients. How does that, as far as for their future medical, do you guys refer them to a prosthesis company, or how does that work to get somebody basically who basically has to get their leg amputated, chopped off? What's the duration of the therapy and them getting back to walking with a prosthesis?
Ooh, that's hard. Yeah, we send them out to different prosthetic companies. One's Hanger, they're excellent. And we basically put them in a prosthetic. And unfortunately, the problem is that on the contralateral limb, so if they get their left leg amputated on the right side, they start developing calluses and, God forbid, wounds. And actually have a patient of mine, ironically, she just texted me today saying, hey, I have a new wound on my left foot, and she had a right lower extremity amputation.
Correct.
Because they're dumping all that weight on the other side.
Correct.
And, a lot of these patients, if you're diabetic, you'll have neuropathy. You can't feel your feet. So she has no idea that she has this nasty infection in between her fourth and fifth toes. And she shot me a text saying, hey, does this look infected? And it looked like there was a balloon inside her foot. I'm like, yeah, you may want to go to the ER.
And this is why experts like Dr. Terani is just so important. It's not about the immediate care, which is the amputation. It is the life care. It's about when the doctor brings it home, what that particular patient, the suffering, the physical, emotional, financial suffering that patient has to have in the future. And for all my attorney guests that are watching right now, or law offices, that is, the $1 million question. It's about future medical, and it takes the right experts, the right person, to be able to say, oh, okay, this is what's going to happen based on their age, based on their comorbidities, if they're diabetic, if they have vascular issues, if they got heart failure. It's a systemic issue. That is where the difference comes in our med-legal type of world, is to get across, well, okay, we had an amputee. Well, it doesn't stop there. It doesn't, the suffering doesn't stop because the leg got chopped off. In my perspective, the suffering is just starting. So for everybody watching, Dr. Terani is an excellent expert. His reports are on point, and he mentions and documents these important things about people, because their comorbidities, their diabetes, might have not been caused, obviously, by the accident, but guarantee you it comes into the accident, and the type of treatment that they have to have and heal from. So Podiatrists from the knee down are the best specialists that I've seen out there. And Dr. Tehrani, where are some of your locations so the audience can use you, refer you for their
Sure, yeah.
services?
I'm all over California. I go to LA, San Diego, Sacramento, Oakland, Fresno, Riverside. I have a location in Hawthorne. And in June, I'm opening up a Vegas location as well. So
Well, that's great.
yeah, it's
Well,
busy.
people need your help and your expertise, and we're thankful that you're here. You're in our industry, and
Thank you.
we would love to support you, and everybody out there support Dr. Tehrani because he's an excellent surgeon and an excellent physician. Thank you for joining us, and we hope to have you back again. And you guys out there, keep tuning in. Thank you very much, Dr.
Thank you.
Terani.
I love his scrubs too. That's nice. Miami Vice vibes.
Take care.
If you want to contact Dr. Benjamin Tehrani, you can visit his website, www.kpfoot.com.
Hi everyone, I'm Danae Jones, your local representative for Global Financial Partners, the one-stop shop for all your funding needs. I'm excited to connect with you today and pleased to always support the incredible work you all do in the personal injury space. I'm also proud to share that Global Financial Partners sponsors PI Today podcast, helping bring valuable insights and medical education to our community. And don't forget to like, comment, follow, subscribe, and share this episode. See you all next time.